Hi, everybody. We really apologize for the technical difficulties we just experienced for about 15 minutes. Google Hangouts and this webinar jam system clearly has some faults, and we are having some great experts from around the state call into us. So I'm glad you're here. I appreciate you waiting and sticking it out. We appreciate you very much sticking around. As a reminder, this will go out as a recording through the email system, and we'll also house this at enrollnebraska.org/EEG. So speaking of housekeeping things, you are now part of this webinar. Our chat system for questions and anything that we need to know is on the bottom right-hand corner in your screen. You can follow along with us through this PDF we broadcast to everybody. And that's how this works. Today we're going to be talking about health insurance through the Affordable Care Act. And this is, let's see here, there we go. Yeah, so I want to introduce you to me. If you haven't met me or seen me before or been on one of these, I'm Eric Saviano, the statewide coordinator for Enroll Nebraska. We are based out of Nebraska Appleseed, which is a social justice and public interest law firm in Lincoln, but we serve the state. We are going to go through a few things on this webinar. Specifically, we're going to talk about Enroll Nebraska and the overview of Enroll Nebraska, what we do and how we do it. We're going to talk about health insurance through the Affordable Care Act, the meat of our session today. Talk about enrollment assistance and how we're going to have a guest speaker on that, and then questions and answers. Hopefully we'll finish up in about 45 minutes. All right. So let's just jump into what Enroll Nebraska is. Enroll Nebraska is a statewide network of community assisters and organizations. We are constantly working to get more and more folks enrolled in the Affordable Care Act coverage that is available through the Affordable Care Act itself that started in 2010. We do that through contracting or partnering with organizations like enrollment assisters, healthcare providers, and advocacy groups. One of our biggest resources is our website, enrollnebraska.org. On that website, we house the Enrollment Assister Map, which is a place for you to find, or for your people that you know to find, enrollment assistance help for free and in an unbiased way. We have an events calendar for events all across the state, including some that we organize as a state ourselves, and also resources that you can use to do outreach, just like this webinar and some of the materials that you're going to find that we mentioned later on. Also, we do a really good job keeping up with social media, I have to say myself. Facebook.com, we have a presence at Enroll Nebraska, and then on Twitter we have at Enroll Nebraska that we'd love for you to share our posts and respond and reply and join that community as it goes as well. By participating in this webinar, I also have you on emails that will go out once a month that happen related to this stuff, including webinars and resources. So this is a group that is not part of our main group with Enroll Nebraska. This is the Education and Engagement Group. We do webinars that help inform the community about the enrollment assistance and the Affordable Care Act, keep people up to date on that ever-changing law, and ever-threatened law, I have to say. So we try to keep people informed. And through this webinar system, we do try to get nonprofits, faith groups, schools, and government agencies, and other low-income serving groups on the line so that we can make make it easy on folks to get the word out. So the webinars occur every month. We think they're a low time investment for you who are on the webinar, and a high impact because we are reaching more and more people through your networks. A quick poll real quick to see who is on the webinar. Ask the question. It should be presented to everybody. Who is on the webinar? Several options you can choose from. I work for a clinic, hospital, healthcare facility, or other healthcare related organization. I work for a health center or community action. I work for a nonprofit. Some of these overlap, obviously. I want to see what people say as their primary location of where they're working. Okay, faith organizations, schools, and others. If it's an other, we'd love for you to put that into the comment box. All right, I'm going to end the poll. It should show up for you. But if not, I'm going to just read them off right now. We'll pretend it's ended. I don't think I clicked the right button. So we had 17% of folks with the clinic, hospital, healthcare facility, 33 work in a healthcare or community action, and 50 work for a nonprofit. So that is everybody. Very cool. Okay, so next question before we get into even more is how much do you know about the Affordable Care Act? All right, so I'm going to make these results public. Sorry I didn't on the last one. How much do you know about the Affordable Care Act? These are very general categories. A lot. Answer some. Answer a little. Or answer none. All right, answers are coming in. I can kind of guess that the folks who know a lot are probably the folks who worked at health centers and community actions doing the enrollment assistance work themselves. And the sum is the majority. I am ending the poll. You should be able to see it. At this point, how much do you know about the Affordable Care Act? 25% know a lot. 63% know some. 13% know a little. And 0% know none. Great. So the some and the a little folks are the people we're trying to connect with today. And today we have Molly McCleary from Nebraska Appleseed, who's the staff attorney with Nebraska Appleseed, to share more about the Affordable Care Act, from the basics on through some of the more complicated stuff. So glad you're here, Molly, and I'll hand it over to you.
Thanks, Eric. So we will just go through sort of a basics of the ACA. I'll try to keep it quick so that we can kind of have some tips on enrollment assistance from our next guest. So we'll just jump right in. We're going to go over a number of different topics on this. Specifically, we'll start with looking at the health insurance climate before the Affordable Care Act, and then the different ways that the Affordable Care Act changed the way that folks access insurance. So how do people find and access coverage through the marketplace, through employers, and through purchasing their own coverage? And then looking at some of the affordability issues, including subsidies and cost sharing reductions, and then some of the consumer protections that are involved in the law as well. So before the Affordable Care Act, people primarily got insurance through their jobs, through government programs like Medicaid or Medicare, or through buying their own insurance, like by going through an insurance agency or something like that. Insurance companies had a lot more leeway in terms of what could be included in plans and what sorts of practices they could employ in terms of denying folks coverage or approving folks for coverage. So before the ACA, people could be denied if they were sick in the past or if they lost jobs or switched employers. And then also the benefits array that was provided in plans could be limited. So things like maternity care or mental health treatment might not be included in a plan. The US also had a pretty large uninsured population prior to the Affordable Care Act. There were about 47 million people or 18% of the population that were uninsured. That number is around 2008, 2009, so right around. So the main focus areas of the Affordable Care Act were changing the way that people could find and access coverage, around affordability and providing assistance to folks to be able to better afford coverage, creating a system that is more fair and provides more valuable coverage. And then also changing the healthcare delivery system to focus on cost control and prevention. What we see with the Affordable Care Act is that the employer-based system of coverage still remains the basis for the health insurance system. So most people will access insurance through their employer just like before. There also is the shared responsibility among individuals, employers, and the government. So individuals have to purchase insurance, certain employers have to provide insurance for their employees, and then the government can provide subsidies for those who are purchasing through the marketplace. So there are sort of the three different ways that people can access coverage. So employers, health insurance marketplace, or the exchange, and then government programs like Medicaid or Medicare. When we talk about employer or individual responsibility, these are provisions of or parts of the law that have been pretty well publicized and discussed in the media, but there is employer responsibility and individual responsibility. So large employers must provide their full-time employees with insurance coverage. And a large employer is 50 or more, and a full-time employee is 30 hours a week or more. Individuals have to purchase insurance or be subject to a tax penalty, which is phased in between 2014 to 2016. And there are exceptions to having to purchase insurance, like financial hardship or certain religious exemptions, or people who have short gaps in coverage of 3 months or less or something like that. But most people are responsible for purchasing insurance. The goal behind this was to broaden the risk pool to have as many people have insurance as possible, so that you don't have a system where only people with high medical needs and expensive medical costs are the ones that are purchasing insurance, that you can have a broad base of people who are covered. The Affordable Care Act created marketplaces or exchanges, and the goal behind this was to be a sort of one-stop shop for private insurance, to enroll in Medicaid if you're eligible, and then also to access tax credits for that private insurance. It was designed that folks, regardless of their situation, could go online to either their state website or the federal healthcare.gov website, depending on what their state decided to do, and find the type of insurance that is best for them, and that they're eligible for based on their personal situation and their income. The marketplace also involves strong consumer protections. When we say that, what we mean is that the plans that are sold on the marketplace have to meet certain minimum standards for what types of benefits are included in the plans. So when consumers go to the marketplace and purchase insurance, they know that they're getting this specific array of benefits, that they are getting coverage that has the types of services that they need. It really changed the way that insurance is purchased from the past, where there was really a big difference between what kinds of plans or what kind of benefits you could get depending on the plan. So Nebraska has a federally facilitated marketplace, which means that we chose not to create a state-based website or anything like that. We use the federally facilitated marketplace, or healthcare.gov. So if a person is looking to enroll in Medicaid or in marketplace coverage, they can go to healthcare.gov. It'll do a sort of screening to determine if they're eligible for, or which program, either marketplace coverage or Medicaid, that they are eligible for. Like most employer plans, there's an open enrollment period to enroll in the marketplace. So to be able to purchase marketplace coverage, there's a set window of time each year where people can go on and enroll. There are special enrollment periods where if a person's circumstances have changed, like they lost their insurance, they got married, they had a child, something like that, they could have a situation where they are able to go and purchase insurance. So for example, if I lost my job and lost my insurance as a result of that, then I would have the ability to go and purchase insurance on the marketplace. There isn't an open enrollment period for Medicaid. If you think that you're eligible for Medicaid, you can apply anytime. So that's a little bit different thing to consider. For consumers who are interested in purchasing marketplace insurance or applying for Medicaid and they're not really sure what to do or how to go about doing that, there are navigators and certified application counselors around the state. Navigators receive federal grants and have to go through a certification process to be able to help people enroll in coverage and kind of get the word out about different insurance options. Certified application counselors are not the ones that receive federal grant money or Navigator grant money, but sort of do the outreach and enrollment work through their regular work. This is probably stuff that you guys all know, as I'm guessing that some of you are navigators or certified application counselors. The next piece of the Affordable Care Act that kind of gets tricky and complicated is the tax credits and cost sharing subsidies piece. So in order to make insurance more affordable for folks to buy on their own, there are tax credits available for people who have an income between a 100% and 400% of federal poverty level. They can get tax credits to offset the cost of insurance and bring the premium cost down. It works on a graduated basis, meaning that depending on the income, the amount of tax credits would be different. It's a graduated scale. If you're eligible for tax credits or if you're offered employer coverage that is affordable, you are unable to get tax credits on the marketplace. There is an exception to the not getting tax credits if you have employer coverage, and that is if your employer plan doesn't meet the minimum standards for marketplace coverage. So if it is a plan that doesn't provide all of the essential health benefits, we'll get to that in a second, or if the employee share of the premium, so what you have to pay for that coverage is over 9.5% of your income. If that's the case, you can go to the marketplace and look and see if there's a plan that's more affordable to you. For cost-sharing subsidies, cost-sharing subsidies are a form of assistance to bring down the out-of-pocket costs associated with health insurance. So the tax credits or the premium tax credits go towards the cost of the monthly premium. The cost-sharing subsidies go towards your out-of-pocket costs like deductibles, copays, and things like that. If you are under 250% of the federal poverty level, that would be when you would be eligible for cost-sharing subsidies. And again, like the tax credits, they are based on an income percentage. There was additionally another part of the ACA that looked to expand coverage and get more people covered, and that was through creating a new Medicaid program or Medicaid expansion. Only certain groups are eligible for traditional Medicaid, and states had the option under the Affordable Care Act to take up a group of individuals who aren't covered by traditional Medicaid, but their income is too low to qualify for subsidies on the marketplace. These are individuals 18 to 64 who have incomes up to 138% of the federal poverty level. Generally, they are low-income parents or people without dependents. And the Supreme Court decided in 2012 in the NFIB versus Sebelius case that this is an option for states that they can decide whether or not they want to take it up. as a state that has not taken it up, we have this gap in coverage where folks in this situation don't really have a path to coverage. They're estimated around 97,000 people who are in this situation, and 31 states and Washington, D.C. have expanded or taken up that option. The last sort of piece to talk about with the Affordable Care Act is how it changes the type of coverage that folks can purchase through the individual market. So there were a number of different changes to practices that insurance companies could engage in, like denials for pre-existing conditions, what insurers could look at when setting premiums. It restricts the things that insurance companies can look at, or the characteristics of a person. So it can, insurance companies can only look at your geographic area, your household size, tobacco use, and your age. Whereas before, insurance companies could look at gender or other factors. There are certain preventive services in things like immunization where there cannot be co-payments or out-of-pocket expenses, and that really goes to that focus on prevention and sort of downstream cost savings. There's an elimination of the lifetime benefit limit. You can stay on your parents' coverage up to age 26. That's one of the more popular provisions that people talk about quite a bit. Your insurance company can't drop you when you get sick. There is a comprehensive preventive benefits package for women that must be covered without cost sharing. That includes well-woman exams and then also contraceptive coverage. And like I mentioned earlier, there's a sort of standard benefit plan for all new policies. So consumers really know when they're going in to purchase insurance that this list of different benefits will be covered. This is the list of benefits. It's called the Essential Health Benefits, or EHBs. When you look at this list, it really is the list of things that you think should be covered under an insurance plan. When you're buying insurance, it's kind of the things that you would want to be covered. There are things in here that are above what a lot of plans in the past covered. So you'll see that mental health and substance use disorder services are now have to be covered in all new plans, as do prescription drug, maternity and newborn care. Lastly, before we get to, I see there's one question that I can answer quickly, but then I want to get into some of the kind of outreach and enrollment aspects of this work. But we wanted to touch on the impact of the Affordable Care Act and sort of what we've seen in Nebraska in the last couple of years since the law has gone into effect. The uninsured rate is now significantly lower. Instead of that 47 million or 18% number that we see pre-ACA, we have about a 91% insurance rate. So I think we're down to a 9% uninsurance rate. So in other words, the uninsured rate has been reduced by about half. Every state in the US has seen a decline in their uninsured rate since 2013. So there's been an increase in coverage across states who have expanded Medicaid, who haven't expanded Medicaid. Across the board, there's been increases in insurance coverage. In Nebraska, we know that 87,835 folks have gained coverage through the marketplace and Medicaid and enrolling in the new options that have been available. So it's really dramatically changed the climate that we are working in healthcare. And there's still a lot of enrollment work to be done, which we can kind of get to some of the good strategies around that. But I do want to touch on this one question. Barb asked, what is the income gap that excludes people from affording the ACA? I'm guessing this gets to the Medicaid gap question, and that would be for folks who are not eligible for Medicaid and are not eligible for the marketplace to be eligible for Medicaid, you have to be low income and also fit into an eligibility category. So you have to be low income, a pregnant woman, a child, a senior, a person with a disability, or a low income, some very low income parents. For the low income parents, you have to be below 58% of the poverty level, which equates to about $980 a month for a family of 3. So it's pretty low. If you're above that, or if you don't have a dependent child, you cannot access subsidy. You can't access Medicaid, but you can't access subsidies until you hit that 100% of the federal poverty level. So basically, it's low-income parents between 58 and 100%, or people without dependents from 0 to 100%. That's that Medicaid gap figure. There's also another question from Sharon. When figuring income to see if the premium from an employer is over the 9.5%, do you use all of the income in the household or just the income of the person wanting to get on the marketplace? It is the modified adjusted gross income of the household, I believe. Where this gets tricky is when you have a situation where, for example, if my employer provides me with coverage for free, and I have a child and I have to pay for that child's coverage, if it is affordable for me because it doesn't cost me anything to get insurance, but it's really, really expensive for my child, it's considered affordable because you would be unable to go get subsidies for the child on the marketplace because it's affordable for the parent. It's under that 9.5% if it's free. We see that a lot. That's what folks call the family glitch, and causes quite a bit of problems for people. So that's something to look out for. I think we can go over to Amelia now.
All right, so there is still plenty of time for you to put questions in the chat box. So keep doing that as you will. And thanks, Molly, for that great overview. We do have more resources on the coverage gap if folks need that. We'll have our contact information at the end of the presentation for you to take a look at and email us. All right, so Amelia Tamayo is with us from One World Health Center, and I am going to actually see if we can get her on the screen so we can avoid seeing some of these random slides. She agreed to it, and I'm happy to let her, there. Okay, so that's me. And, okay, Amelia, unmute yourself if you would. And would you, I had Amelia on because she is a manager of CACs in Omaha, and she can explain a little bit about the enrollment assistance outreach work that we do as a state and the process when people do outreach for enrollment assistance. So I'll turn it over to you, Amelia.
Good afternoon, everyone. How are you guys? Of course, I'm super excited to be here today. I'm glad that Eric provided me this awesome opportunity. I hope you guys can see my face because I am excited. Okay, so what we're going to review today is basically just some the outreach that we do here at One World. If this may be something that you could use in your locations, and something that you may want to kind of do too, right? Okay, so what I would like to, one of the things that we found really useful this year is we of course have folders that we've given to previous patients of ours, previous clients that have enrolled in the marketplace, and we've always asked them to bring those back. So with these folders, we put in the awesome information like, you know, what your login number, what your login name is, username, password, all that good stuff. The copy of their insurance that they picked last year. We put all of that information in this folder. We fold it for them, and just like they do their taxes every single year, they're going to go home with and your taxes, go for it. And then what you want to do the next year, you want to bring that with you, so that way we can ensure we help you and we use that same information. And so that's one of the awesome things that we've used here at One World. Another item that we have is we really kind of done our best to partner with different organizations, such as we have an awesome, huge following of Catholicism here in South Omaha. And so we partner with a lot of the Catholic churches, and we do presentations at the Catholic churches, and we let them know when and where will be available. And that usually goes really well, because at a church, churches are really kind of that sound place where people feel safe. They're going to get safe information, and we are safe people. Of course, we're CAC certified. So these are the good places. This is one of the best places that we found where we go to, where people really say, you know what, I feel comfortable in going to this individual that came to my congregation. And so that's awesome, and that's one of the things that they really enjoy seeing us at those locations. And also, of course, at the end of the day, use your health centers. Health centers, I'm assuming I'm talking to individuals that don't all work at a health center. If they have certified application counselors, you know, hook them up, send them out that way, or of course invite them to come to your events. When you host events and when you have different events, have them here. As you guys know, open enrollment is mad busy. Like, we have so many people. There's always enough people to help and just kind of save them a desk and have them enroll if and when they can. And when you host those large events, even more so. We host an event that's kind of gone really well because we're in the vicinity where we have a lot of people work those 3 shift hours, so they could work from let's say 6 p.m. until 12 a.m. So we have this event that we call our midnight event. It's gone really well the past couple of years that we've had it, the past 2 years to be precise, because we didn't do the first year. And that was amazing. We had people come from the meat packing plants, these other factories, and they said, this time is actually perfect for us. We'd like to come in at 9 p.m. at night, 10 p.m. at night. And so really meeting those people now of where they're at and when they're available is really kind of the key of enrolling individuals at this point, because we really want to reach them where they're at and not make it difficult for them to happen to come into your clinic hours when you're only open 8 a.m. to 5 p.m. or you only have team members that are available to be available during that time. So extending those hours is always the best. Saturdays are always great as well, because of course clinics are not always open on Saturdays. So doing a lot of footwork during the Saturdays is always really good as well. What else should I add, Eric?
I think that's great. I think you did a great overview. I think we can open it up to questions for the group. I know we're running short on time, so Amelia, I appreciate all that work. I'll tell you, Amelia is not the only enrollment assister in the state, of course. I wanted to show you briefly our website that shows folks where local help is besides just Amelia's in Omaha. So Enroll Nebraska hosts our website with this information. enrollnebraska.org/local has this page itself. And as you scroll down, we have our new connector function, which helps you find an enrollment assister by putting your zip code in and choosing how far away you want to find that person. Sooner than later, it's going to have the ability to make online appointments. But our enrollment assister map is also a good way to find information. Clearly, Omaha has lots of folks to choose from and different locations to find those folks help. Lincoln as well. But all around the state, there are not too many big gaps about where folks can find enrollment assistance locations. So with that, I think we can continue answering some questions. Amelia, can you hang out to answer questions?
Yep.
Okay, great. All right, so I saw one more come in. I am going to stop this, share back with this. And so we'll do one question and then I'll share some resources.
Okay, so we have a question from Monica that says, building off of Sharon's question, when you calculate household income, do you include or do you consider teen or child income if they are employed or just the adults? Everyone's favorite answer, it depends. It depends on whether the child or teenager has earned enough money to be required to file income tax returns on their own. Generally, kids who qualify as tax dependents, so it's based on, your household size is based on who can be claimed as a tax dependent, so you, your spouse, your child. And if your child earns enough money that, generally kids who qualify as tax dependents aren't required to file income taxes on their own because they earn less than the filing threshold. So it depends if the teen or child earns more than the filing threshold. We have another question. Did you want to answer that, or you want me to?
Yeah, I want you to read that, and Amelia, read that too. And I am going to do a couple resources really quick, and then we'll get back to that question that Barb posted to everybody. So we have 2 or 3 resources for you to do outreach in your communities through Enroll Nebraska. These are all for download at the below website. The Basics of the Affordable Care Act in English and Spanish can help if you post it in places you want to do outreach in your networks. It's easily emailed to. It's a PDF. We could print some for you as well. Goes over some of these basics we covered today and more. We also have a resource about once you get health insurance, what are some of the common terms, and health insurance literacy is the catchphrase we use for that kind of things. What is a premium? What is a copay? Cost sharing is new to a lot of people. Deductibles. That's in English and Spanish as well, and is available for download on the Enroll Nebraska website. Finally, we have printable postcards that are in English and Spanish, and they can be cut into 4s and put on counters, really easily accessible for people all around the state. We offer folks the enrollnebraska.org/local website that I just showed you, but also the United Way's 2-on-1 referral service. They're doing referrals for us in the same way that Enroll Nebraska can do referrals. So ran through those really quickly. We'll go back to these questions now. These are our contact informations. I think everybody's willing to answer questions. So the question is, Creighton Social Work has a CDO when students complete the training and they want to go to, say, a church to help people enroll. Where do you keep the paperwork and keep it secure? So that relates to personally identifiable information. And I wonder if I should send it to Molly in the room or Amelia.
Probably Amelia. I have some thoughts, but you probably know better than I what works best in practice.
Am I on?
Yes.
Okay, so usually what happens, we do not do any enrolling within at these locations. What we always try to do is we do education when we go out to the churches and so forth. But when and if we do, we haven't done this for the past 2 years because of this specific reason, due to carrying that type of information that is HIPAA related. What we would do if we did do that type of event is we have a briefcase where we have that zipped and locked, and whenever we transport material to and from to enter in the database, we put it in this briefcase and we ensure it's locked, and we travel and we kind of take it back and forth. But ideally, I always encourage individuals, if you want to do it out there at those locations, great, but that would be the key item to hold and make sure you have that available, because if those items were to get lost, it is a liability. But that's one way you could kind of do your best to make sure it doesn't happen. We do our best to ensure we do not do any enrolling outside of our facilities or buildings as a whole, but I am a little bit different in the sense that we do a lot of enrolling at our locations, and we have about 5 of them, and that's where we do our
location. And Barb, I'll follow up with you. I'm sure I have your email about how those folks handle those situations. And then another question came in: where can we get the marketplace folders and packets that were mentioned for people we assist? And I believe that Amelia has, and the health centers around the state have created their own packets that they use. I think also that they can possibly share the contents of those packets, and we can show those as a model for you, Jamie. I'll try to send that in our follow-up email if you don't mind.
I can shoot you some examples of the tools that we use as well that we created on our own if you're interested as well.
Yeah, that sounds great. Amelia, send those over to me and I'll send them to the group. Okay, any other questions? You have about 1 minute and we are running out of time on the whole presentation. So I will, looks like lots of thanks. We appreciate you guys too for being here and dealing with our technical difficulties. I really, really want to thank Amelia for presenting to the group, and also Molly for presenting about the basics about the ACA. Everyone has our contact information if there's follow-up materials. This information is also, this is clearly recorded, like I've said before, and it's going to be housed at enrollnebraska.org/EEG under the date of today. So you can always go back and refer to this or send it around to people that you know. Actually, we don't have a 3-minute survey today. Our next meeting, though, is relevant. It's going to be open enrollment is starting this November 1st. So we're going to have our next webinar, the October 21st, talk about new developments with the ACA, open enrollment toolkit, and how you can help people get more people get enrolled. So with that, no more questions have come in. I want to end the webinar and thank everybody for their participation. Have a great day. Bye-bye.